Paris, thank you. Illinois children between ages 5 and 11 have started getting vaccinated against COVID-19. According to the state public health department, since the CDC's approval last week, approximately 15,150 pediatric doses have so far been administered to Illinois children in that age group. The city of Chicago is aiming to boost vaccinations with a vaccine awareness day on Friday. But that is causing some issues. Amanda Vinicky joins us now with more. Amanda.
Yeah, Brandis, the number of doses given to younger kids in Illinois could actually be higher, given that there's a 72-hour lag in reporting. And then also additional training is required. So some pediatric providers may still be having their own lag time before they're ready to jab children in the arm with that COVID vaccine. But that is already underway at Lurie Children's Hospital, which on Friday held its first clinic for that group of youth ages 5 to 11. And more than 1,100 doses were administered to children in that group so far. Dr. Jenny Kuzma says that it is a good week to be a pediatrician.
It's been really well studied. It's been reviewed by a lot of people. And so I would say I have confidence in the safety of this vaccine. I think that's a really important piece.
And so she says it is normal for parents to have questions, and if so, she encourages them to talk to a doctor. The studies on youth took place during the summer when that Delta variant was surging, and still the vaccine was proven to be effective, even as younger kids receiving a smaller dose.
And what's interesting and exciting is that that dose is smaller, but the immune response or that antibody response is actually very much similar to the adolescents or adults who got the larger dose of the vaccine. So smaller dose, but we're seeing that same great robust immune response.
Now, UI Health began giving children in that group that shot today. And the head of the Child and Youth Center says that her kiddo is going to be getting the shot, and she encourages other families to do so as well. Kids, after all, can get serious cases of COVID.
It's hard to know which children will be severely affected, and we do see children who need a lot of support from the breathing and the heart kind of complications that go with COVID. Many people of all ages do well having had the infection, but it's just so hard for us to know who will and who will not. And we are seeing some children with the infection in our hospital as we speak.
But some parents aren't ready. Willie Preston is a father of 6 children who go to CPS schools ranging in ages from 16 to 5.
My wife and I are not currently at a place where we feel comfortable giving our children the vaccination. Certainly not our 5-year-old. The vaccination it seems like it's rushed. There's little to no. We don't know enough about it.
Now, parents like Preston are who Chicago Public Schools administrators may have had in mind when late Thursday the district announced it's canceling classes on Friday for that vaccine awareness day. CPS billing it as an opportunity for the most recently eligible to receive the vaccine as quickly as possible, also ahead of the holidays. But for Preston, it is frustrating. He says vaccination should be up to parents. It's about choice, and he believes it is clear that CPS's new CEO did not consult with families. He thinks then they would have considered what it means for working families like his own, and that is a huge child care problem.
The very short notice of the kids having a out of school day that we had no knowledge of is 100% has created a child care issue for my house and for my wife and I. So at this point, we're probably going to stick some names in the bag, shake it up and pull and see who's going to take off work that day, because we just don't have that child care help in place.
Also to consider, parents or guardians need to be on hand for those minor youth to get the vaccine. Also, the day before, Friday, well, that is also a CPS and a federal holiday because of Veterans Day, still one that not all workers get off. Founder of the child care and sitter service, Baby Maven Brittany Gabby, says she began getting frantic calls from parents when that announcement went out late Thursday. Her company organized a small group sitting session, and there are still some spots left.
They can reach us via email, and it's as simple as, us getting your child's contact information. We wear masks. All of our sitter mavens are wearing masks, and lunch and a snack is provided. So we're going to try to lean into filling the gap for that support for those 2 days.
Both Lurie's and UI Health are also expanding their vaccine clinic slots on Friday for that CPS Vaccine Awareness Day. Lurie, for example, another 50% of slots available, so about 600, and they will be open instead of from 1 to 7 just in the afternoon. They'll be opening starting at 9 a.m. You do not need to be a patient to get a vaccine or to have your child vaccinated at either of those clinics, but you are supposed to register for that slot and sign up online. Now, by the way, CPS did not respond to questions, including one from critics that suggests that that day off on Friday, that really what it is all about is a lack of substitute teachers available that day. With that, back to you, Brandis.
Amanda, thank you.